Hello friends, welcome back to another video. So today we are going to discuss what is cannabis, what cannabis actually is, how people use it, and why people use it, like what are the purposes of using the cannabis. Now first of all, we're going to have to see what is cannabis. Now cannabis comes from one of the two plants, Cannabis sativa and Cannabis indica. Cannabis contains chemical compounds called cannabinoids, for example, THC or CBD. How is cannabis used? Now, the reasons for using cannabis is that they have effects on the mind, like they can give you a high, an intoxication, or calming effect. The second use is medical, social, or for the religious purposes. It can be taken in many ways, such as smoking, drinking, eating, and vaporizing. We're gonna see a Canadian cannabis survey who is using cannabis. Now, about 22% of survey respondents above the age of 16 had used cannabis in the past 12 months. Ages 16 to 24 uses twice that of 25 plus age. Now, average age of first cannabis use is the age of 19 years. Canadian Cannabis Survey 2018, we see that daily use of cannabis is 19%, 3 days per month percentage is 55%, and 1 day per month percentage 35% of people in the Canada. Now, cannabis used to get high before or at school. We have percentage at school. They have never people who never used cannabis is 50. Now, if we talk about the people who rarely used cannabis in Canada are about 27%, and people who used on weekly basis are 12%. Now, if we talk about people who use cannabis at work, people who never used cannabis have the highest percentage of 64%. People who use sometimes or oftenly have 15%, and people who use weekly or 8% of the total population in the Canada work-based. Now we're going to see what are the possible effects of cannabis. Now there are some short-term effects, and of course there's some long-term effects as well. We have here on one side positive, and on the other side we have negative effects. If we talk about the positive effects of cannabis, we have feeling high, which is also known as euphoria. On the second hand, we have sense of well-being. We feel very good. Relaxation, heightened sensory experiences, sight, taste, smell, sound, touch. And people feel very good after using cannabis. So these are the positive effects of using cannabis. On the other hand, we have negative effects which lead to confusion, sleepiness, trouble concentrating, remembering, and anxiety, fear, panic, also damaged blood vessels, increased heart rate, paranoia, delusions, and hallucinations. Now, there are some possible long term effects. We're going to see what long term effects are. Now, daily or weekly use continues over months or years can increase the risk of addiction, impairment of memory, concentration, and intelligence. It can also it can also affect your lungs, causing bronchitis, lung infections, chronic cough. These are mainly caused due to smoking of cannabis. Now, effects that appear to be worse. These are started using early in adolescence, using frequently for a long time. Now, if we talk about medical cannabis, which were used in the use of therapeutic medications, we have several uses of medical cannabis, such as it is mainly used in chemotherapy induced nausea and vomiting, multiple sclerosis, chronic pain, anxiety and depression, sleep disorders, inflammation, irritable bowel syndrome. Now, cannabis is not an approved therapeutic product unless the product has a drug identification number and is prescribed by a doctor. As you know, it is a narcotic, so it is well managed and is prescribed only by a doctor under his signature. So that's all from my side. See you tomorrow with another part of cannabis. Thank you. Have a good day.